You know, the entire story of this disease really begins at the microscopic level. It all comes down to our red blood cells, those little oxygen carriers zipping around in our bloodstream. But as you're about to see, this is really a tale of two very, very different kinds of cells.
And here it is, the heart of the problem, right here, side by side. On the left, you've got a healthy red blood cell. It's round, it's flexible, and it just glides through your blood vessels delivering oxygen. Easy. But on the right, well, that's a sickled cell. It's C-shaped, it's stiff, and it's sticky. And that simple change in shape and texture, that is the root cause of every single complication we're about to discuss.
So, to put a formal name on it, this is sickle cell anemia. It's an inherited blood disorder, and it's all defined by that abnormal C-shaped red blood cell. Now, there are a few different types of sickle cell disease, but this is the most common one. And yeah, unfortunately, it's also the most severe.
So, how does this even happen? Genetically, I mean. Well, it all boils down to one specific gene called HBB. Think of it like an instruction manual for making hemoglobin. That's the super important protein that carries oxygen in our red blood cells. But with sickle cell, a single little typo, a variation in that gene, basically rewrites the instructions. And the result? The body starts producing those flawed, sickled cells.
Okay, so let's zoom out from the cellular level and talk about the human experience. What does this microscopic battle actually feel like for a person who's living with this condition every day?
Well, since this is all about oxygen flow, the symptoms can affect the entire body. Chronic fatigue is a big one, because the body is basically being starved of fuel. The spleen, which is a key part of our immune system, often gets damaged, and that leads to frequent infections. And then, of course, there's the hallmark symptom, these unpredictable episodes of intense, just debilitating pain, often with painful swelling in the hands and feet.
And what's really tough is just how early this whole battle begins. The first symptoms often show up in babies, as young as 6 to 9 months old. So right from the get-go, this becomes a lifelong condition.
This is really the perfect way to picture it. Think of a massive traffic jam happening inside your smallest blood vessels. Healthy, flexible cells, they just navigate those pathways with ease. But the stiff, sticky sickled cells, they start to pile up. They create these blockages that stop the flow of blood and, most critically, oxygen.
And these traffic jams, which doctors call vaso-occlusive crises, they aren't just painful. They can lead to some really severe, even life-threatening medical emergencies. This is when the disease shifts from being a chronic condition to a full-blown acute crisis.
For example, a blockage in the brain can cause a stroke, and tragically, this can happen even in very young children. If those clogged vessels are in the chest, it can lead to something called acute chest syndrome, which is a really serious condition, kind of like pneumonia. And over time, this constant lack of oxygen can cause severe damage to major organs like your kidneys, liver, and lung.
But the story definitely doesn't end there. Medical science has been fighting back big time. We've developed all these ways to manage symptoms, prevent complications, and really improve the quality of life for people with the disease. Let's take a look at how.
So this is it, right? The single most important question for anyone affected by a chronic disease. After everything we've just talked about, is there actually a cure for sickle cell anemia?
And the answer is yes, there is one. It's a stem cell transplant from a healthy donor. What this procedure does, essentially, is replace the patient's bone marrow, which is like the body's blood cell factory, with a donor's healthy marrow. This lets the body start producing normal, healthy red blood cells again. Now, it is a major, complex procedure, and it's usually only for the most severe cases. But right now, it's the only option for a complete cure.
But a transplant just isn't an option for everybody. Luckily, there are some pretty powerful medications out there to help manage the disease. Hydroxyurea is a treatment that's been around for a while, and it really helps reduce those major complications. Then there's L-glutamine, which works to keep the cells from getting worse. And a newer drug, crises, is designed specifically to lower the number of those painful traffic jam crises.
So with all these treatments available, what does the future look like? Let's talk about the long-term outlook for someone living with sickle cell anemia today.
You know, to really understand how far we've come, we have to see where we started. And it's honestly hard to even imagine, but there was a time, and not that long ago, when very few babies born with sickle cell anemia even lived to see their 5th birthday. The progress since then has just been incredible. I mean, thanks to things like newborn screening, early diagnosis, and all the treatments we've discussed, many people with the disease are now living well into their 50s and even beyond. That is a monumental leap in life expectancy in just a few generations. It's amazing. But the progress doesn't stop here. Not at all.
Every single day, researchers are testing new medications, new therapies, including gene therapy, in clinical trials. The journey from a 5-year life expectancy to 50 years has been absolutely remarkable. Which leaves us with one final, very hopeful question. What incredible breakthroughs are the next few decades going to bring?